At the 61st session of the WHO Regional Committee for the Eastern Mediterranean, urged member states to urgently undertake a comprehensive assessment of their capacity to deal with the potential importation of Ebola virus disease to identify the main gaps and address them. This was in response to the largest and most complex Ebola outbreak on record in West Africa. The outbreak represented a threat to global health security and highlighted an urgent need to enhance country preparedness and response capacity. Although the risk of transmission of Ebola through international air travel was presumed to be low, it was considered the most probable route for its introduction into countries of the region. Rapid assessments of preparedness and readiness measures were conducted in 20 countries between November 2014 and February 2015. A number of critical gaps were identified, including limited capacity for prevention, detection, and response in the areas of leadership and coordination, surveillance, infection prevention and control, risk communication, points of entry, and laboratory diagnosis. Following the assessments and a third regional stakeholders meeting to review implementation of the International Health Regulations, IHR, with a special focus on Ebola, in January 2015, a 90-day action plan was implemented from March until the end of May to enhance preparedness and readiness measures in the region and bridge critical gaps through activities aimed at mitigating any threat. In the areas of leadership and coordination, WHO supported countries in developing response plans strengthened by incident command systems, organizational response and coordination structures, and a set of operational procedures. To strengthen capacity at points of entry, around 100 officials were trained on developing contingency plans in workshops which took place in Jordan, Oman, Pakistan, and Tunisia. In the areas of surveillance and contact tracing, to address the absence of multidisciplinary rapid response teams or RRTs, pilot training to establish RRTs with skills in contact tracing, field investigation, and response was conducted in March in Sudan, followed by 3 more rounds of training in Jordan, Morocco, and United Arab Emirates between April and May 2015. An operational model for events-based surveillance as a means to verify, investigate, and detect early any public health threat such as Ebola was initially developed in Qatar. Biosafety measures were improved through safe collection and transportation of dangerous pathogens, and capacity building and laboratory diagnosis of Ebola was conducted as a major component of the plan. 21 staff were trained and certified in 2 rounds of training in May on the safe collection and shipment of dangerous pathogens. In addition, 10 laboratory staff from countries were also trained in diagnosing Ebola at the Pasteur Institute in France. Capacity building activities for essential infection prevention and control measures were conducted for 35 staff who were trained at the WHO Collaborating Center for Infection Prevention and Control in Riyadh, Saudi Arabia in May. To address gaps in risk communication, countries were requested to identify focal persons to oversee this area of work. A workshop on risk communication and social mobilization was conducted in Amman, Jordan in April, resulting in the establishment of the Eastern Mediterranean Risk Communication Network. This was followed by 3 sub-regional training courses on risk communication and social mobilization for 95 Ministry of Health staff, conducted in Jordan, Oman, and Sudan.